Hey there, in this video I'm going to teach you how to help a child with unstressed syllable deletion. So this is when they're taking multisyllabic words and they're dropping out one or more syllables from those words. And usually it's the unstressed one, the one we don't put much emphasis on. So for example, the word umbrella might become brella. Now this is pretty common up through about age 4, but if we have a child who's still using it after 4, we can use these steps. This is the phonological approach to treating unstressed syllable deletion. So we're going to start at phase 1 with auditory discrimination. So for this phase, we are going to help the child hear the difference between words with 2 and 3 syllables. So we'll show them one of these pairs and we will say the words for them. We'll say ladybug, lady. And then I'm going to say, okay, I want you to point to the one I say. Listen, ladybug. And see if they can point to the correct word. If they do, awesome. They hear the difference between those with more or fewer syllables. If not, then we want to point it out. We want to help them understand. So we would say, oh, listen, this word has 2 parts. Lady, lady. I hear 2 parts. Let's listen to this one and point to ladybug. Ladybug, ladybug. How many parts does this word have? 3 parts. So then you help them hear the difference between the 2 and point to the correct picture. Okay, we're going to keep practicing these until the child can point to the correct word. And then once they can do that, we can move on to phase 2, which is production in single words. So now we're actually having them say the words. So we'll have them say ladybug, lady. Now, if they are dropping out one of those syllables, then we're going to help them clap it out. Ladybug, and help them get all of the parts. If you need a visual, you can draw 3 dots and have them tap for each one. So we can say ladybug, ladybug, and put them together that way. So we'll have them practice this. You want to keep practicing these 3-syllable words, or in this case 2-syllable, just these multisyllabic words until they can get all of those. And then once they can do that, then we can move on to saying those words in short phrases. So red ladybug, jellyfish sting. So again, if you need to get back out a visual and have them tap it out, you can do that. But you're going to make sure that they can use a variety of multisyllabic words in short phrases, 2 to 3 words. If your child, the child that you're working with, is doing okay with 2-syllable, I looked at the jellyfish, 2-syllable or 3-syllable, you can even add some 4-syllable and see if you can tap out or clap out 4-syllable words as well. Once we get done with that, then you're going to move on to the sentence level. So you're going to give them a multisyllabic word. You're going to have the child create a sentence using that word. So they might say, I eat a cookie. Now the key is to make sure that every multisyllabic word in the sentence is produced correctly. At this point, we want all the words in the sentence to be used correctly. You can also, once you get done with these, expand this out by giving them more 3 and even 4-syllable words if they're ready for that, and help them practice using longer words in sentences. Now, at this point, once you get through sentences, you have the choice to, you have 2 choices. You can either go back and work on a different phonological process and just kind of keep an eye on this one and see if this one starts to generalize to conversation, or you can move on up and you work on this skill in the conversational level. And we have a kit for that. If you scroll down to below the therapy phases on this page, you'll find the link to the generalization and the carryover kit, so you can use that. All right, we have other resources down below, so keep on going.